My name is Roger Kula, and I am recently been appointed as medical director of the Chiari Neurosurgical Center at NSPC, which stands for Neurological Surgery PC. I've been involved with CSF in one extension or another through the years since the origination of the foundation, which was in 2007, I guess it was, and been actively involved as part of the C Board, which is the Scientific and Education Board for the institution. And I've been working with a number of people nationwide and now actually internationally involved in research and funding and public information and an organization of what has become a real mission in the last 2 years, which is the establishment of an international registry for patients with Chiari, Syringomyelia, and related disorders. It's really been a grassroots effort, patient-driven and physician-driven, to meet the challenges presented by a complicated and relatively mysterious disorder in many ways, and we've achieved a tremendous amount with the support of the Chiari and Syringomyelia Foundation, leading to a better understanding of correlated problems and kind of redefine the approach to Chiari malformation as one of looking at the multifold causes of tonsillar herniation and distinguishing these causes and trying to look at what treatment modalities might best fit certain presentations. Physicians in their training learn how to approach patients pretty much by gestalt, which means you are always looking for something and you only see what you're looking for. When you get to a physician and you present more than 5 or 6 usual symptoms, their eyes begin to glass over, and before you know it, there's a recommendation to see a psychiatrist or that the suspicion that many of these are functional abnormalities. And oftentimes, in my experience with patients examining, that there are very few physical findings that underlie a lot of these. It's really functional disturbances resulting from compressive issues in the posterior fossa that lead to, very confusing symptoms. The educational thrusts in many of the national meetings at the level of neurologists in practice are focused and supported by many pharmaceutical products that are directed at migraines, so that there is not much of a thrust outside of a few of the patient-driven organizations, most important of which is the Chiari and Syringomyelia Foundation, to really support recognition and education. So it's a very important issue. This registry that has been developed is to allow the patients really to present symptomatology that we can better understand and analyze in a way. It kind of is an evolution of the concept of big data, as is now widely talked about in industry and other circumstances. The power of being able to assess a major fraction of patients with Chiari can allow us to answer questions that would otherwise be very difficult in a prospective way. For instance, if we wanted to try to analyze the results of surgery, we'd have to treat certain patients with a certain surgery and then other patients with another kind of surgery. It's very difficult research to develop. Whereas if we looked at all patients in a very large population that had certain surgeries and look at how they did, we can get a valuable amount of information about what seems to work and doesn't work. The information is anonymized in the sense that that they can't be traced back to the patient. So that gives them, right at the very beginning, a protection of privacy, and it allows the physicians to be able to deal with that information on a group basis. That's what we're after, actually, in the end anyway. We're actually looking for group statistics, large volumes of statistics to look at. Patients help the physicians learn more about the process, and that's the opportunity they have with the registry to make this information available so that we can analyze it better, and through the volume of patient input really develop a much more solid understanding than it's almost like looking through a peephole, like in Alice in the Looking Glass. You can only see so much, and if we have a broad expanse of patient experience to draw from and analyze, I think will be a valuable source of information, and also direct management and patient awareness. The way the project is set up, the patients have the ability to control their unique settings, and they have the ability to control the amount of information that is released and the type of information that might be available, as well as to restrict it to different research programs. In other words, they can have some control over what researchers might have access to their information. Privacy might let just limited factual data about their age, some minimal demographics and what surgeries they may have had, to a whole range of examination features, imaging features, results of the surgery, as well as their psychological factors or assessments and how they have or haven't contributed to it, as well as some social issues about what the impact of the disease might have on caregivers and the costs involved as well. Well, I myself probably would be pretty liberal about letting, because of my thrust to have knowledge available to other people. Groups that might want access to the information have to pass certain restrictions and to be vetted by both the CSF group and the restrictions in the peer database group before they're allowed to have any access. So there's just really elaborate checks and balances that are unique, not only on the patient side, but on the investigator side, that are screened by the people that are overseeing the development and the protection of that database. The whole thrust of this is to make aggregate information available to researchers and people with specific and vetted interests in developing better patient management, better patient care, and that is under a very strict control of the organization involved in supervising that access on a regular and ongoing basis. For instance, patients might have a concern about the accessibility to their information from CSF itself, and might have a concern about their information being used for fundraising activities, and it's important to communicate to that group that that's not part of the process, and in no way will any of their information be used for fundraising activities. It's strictly regulated for research purposes. Will any of this research lead to the potential for requests for blood samples or tissue samples or genetic testing is a valid question, and that certainly might be the case in certain research proposals, but the patient would have control over the release of their contact information for such purposes.
So who is that organization?
That's CSF, the Chiari and Syringomyelia Foundation. And that is taken very seriously as a responsibility.